Welcome, everyone, and thank you for joining us today for the second COVID-19 SMA Community Webinar. We are excited to see so many questions have been submitted in advance of this webinar and to have folks joining us live. We will try to answer as many questions as we can during the presentation as possible. You can also submit questions during the call in the chat box on the bottom right side of your screen. The lines will remain muted during the call other than for the speakers. With that, I would like to pass the discussion over to Kenneth, President of Cure SMA.
Thank you. And just wanted to say thank you to everybody for joining us again here today on one of these webinars where we're going to focus on the COVID-19 situation and in particular its impact on the SMA community. And so before we dive in, I did want to kind of lay out initially the general recommendation that you're going to hear as a theme throughout all of the specific topics that we touch on. But basically what you're going to hear from us today on this webinar is that our recommendation right now is that we need to continue on with the isolation, the quarantine that we in the SMA community have been doing for the last 2 months. We need to keep that going. Even while the rest of the country is starting to open up, we've got to maintain that. And basically we're saying that for the next 2 months, we need to keep going with all of the procedures, the hygiene, the isolation and quarantine that we've been doing. It's really not safe yet for SMA patients and caregivers, family members to go out. We need to kind of maintain that for another couple of months. So we'll get into some of the specifics of why and also what we're doing to kind of help support that continuing on. We know it's going to become a bit of a challenge to kind of keep this going and keep the motivation going. And so we're going to talk about programs and resources that we're going to be putting in place to try and help that keep going through for another couple of months. So if we want to go to the next slide. What I also wanted to do to kick off was just show how the topics that we're going to cover on this webinar fit into some of the other webinars and virtual sessions that we've had going on and some of the other programs as well, support programs that we put in place. So we are shifting over time. Initially, we tried to put on emergency support programs, webinars, resources, information, and some of the packages as well that were really kind of a quick emergency response for SMA community members to try and stay safe from the COVID situation. And those packages, they're still available. Hopefully, a lot of people have got those, but they're still there if anybody needs them. And there's easy ways to kind of find and apply for those if anybody still needs any of those packages. What we're doing now is shifting a lot of our programs that we would have been doing in person to virtual platforms. And so some of these have already happened. We actually changed the Summits of Strength, which were our local in-person mini one-day conferences, and moved those over to be virtual, but also changed the theme so that they are trying to focus on topics that are practical for now in mostly the medical area, in the care area, that's practical for people to do at home. And so we've done some already. We've done 3 that were focused on nutrition, physical therapy, mental health, kind of these care aspects, which are very important. But as we've been stressing, we need to try to conduct those at home rather than going into medical settings, into hospitals and visiting doctors. We've done 3. We're going to take a little bit of a pause as we now kind of do the conference activities, but those summits should be coming back. We'll look to do another few rounds of those in maybe July, August, and we'll kind of roll those out with some additional helpful topics as well. We're doing this webinar right now that is focused on COVID. And I think we're doing this because we want the theme of the conference that's coming up to be a little bit different. And so we want to get the COVID information out now. And then at the conference, we're actually going to try to make sure that at the conference, we almost don't talk about COVID so much, that we're going to try to focus on all of the ongoing work that we in the SMA community have had going on that is so important. And I think in some ways is kind of a bright spot behind all this, that all of the work on research and care and treatments and, just supporting each other with new support programs totally outside of COVID, all of that's still been going on. Even while we've all had to kind of change and adapt in such, significant, drastic ways, our work and our progress has been going still behind the scenes. And so hopefully some of that you've seen with funding for basic research grants, which is so important. You'll see something new about a brand new area that we're going to get involved in funding for clinical trials and clinical research, which we still need to have going on. And so the conference is going to be a little bit more about getting back to kind of focusing on the future and when we get back to normal, All of these things have still been going on. We haven't missed a step, and they're going to be there, and we won't have kind of slipped back in any way on all of the things that are really important for us moving forward. And in particular, I think one thing to watch out for is that Jill and Mary are going to do a special session on all of those activities, including the trials, regulatory updates. We're hoping for a big new milestone to come through quite soon in that area. Jill and Mary will cover that in a recorded session that you'll be able to kind of watch it at any time rather than having to kind of call in live for a particular session. So that should be, a different message than we've been kind of talking about recently. And that kicks off the conference, the virtual conference that we put on, not next week, but the one after. The agenda and everything is now out. It's available, and more information should be following soon. And definitely, it should be a good conference. Where I think it's only just sinking in now that, we really are going to miss the in-person interactions there. There's nothing that we can do to replace those, where we all get together, we see each other in person, we meet the researchers and industry and our clinicians, some of those great opportunities just to network and be a strong community together, the wheelchair race. There's nothing that can replace those. So we'll do the best we can with providing, some hopeful, uplifting information about this good progress that we had going on. But we're definitely going to miss seeing everybody. And so we'll get through that in a week and focus on the future. The next stage for us that we're focused on with information, but also resources that we're going to try to bring together is focused a little bit more on the activities that we're all going to need to do for daily living at home going forward. We've touched on kind of how we look at treatment, how we look at care, the medical side. What we think is going to become very important over the next 2 months are resources support for everybody to kind of get activities of work, education, social interactions being done at home, isolated still. And so I think we'll touch on that quite a lot throughout this webinar, how we see that playing out and what we're going to do to try and support that. So the next slide, we just wanted to share a little bit of information that came together to us from all of you with information that you've shared, information that we've collected on the actual impact of COVID on the community in various different areas. And we wanted to share this. It's interesting for all of you to see. We wanted to share it as well to say thank you for sharing this information with us and to let you know that this is practical information that we use internally to make sure that we're giving the right support programs. We use a lot of this, though, in advocacy work, that when we can show at the federal level or state level these statistics and this data to back up what's happening, what the impact of COVID is on the SMA community and SMA patients and families, this is very powerful to get change to happen. So sharing some of these details, we've seen about a 20% impact on treatment, actually going in and being able to get treatment due to COVID and either kind of cancellations or delays for getting treatments done. And that's a lower level than some of the other kind of areas of impact. And so that's good. This is something that we've been stressing, that getting treatments on time, not having those delayed too long, maybe a few weeks is okay, but not canceling them, not letting treatment visits go out for months at a time is very important in this situation. And it seems like that's playing out with this kind of lower level of about 20% of community members having some kind of delay or cancellation for treatment. We've seen a higher level of impact on care aspects, where it's a care visit or looking for services such as physical therapy. And this is what we expected, and it's actually what we said is probably good in some ways, that people need to have a little bit more flexibility there and try and stay away from hospital settings, try and use telemedicine, try and look for alternatives to do these particular care, medical, physical therapy, the topics that we're covering, nutrition at home. And so you can see about 37, 49%, about a half of the community has had some impact from COVID in that area. On the kind of the financial economic side, definitely a big impact here as well, like for the whole country and the whole economy. It's about 34% have said that they've had an issue with their specific job, but 66% had some kind of financial impact as well. So it's a very high there. And that's something that we're watching, especially from the work environment as the country opens up, but we're going to have to stay isolated. There's a few other areas of impact, and Mary's going to touch on these. In particular, the direct affected impact of people actually getting symptoms diagnosed going into hospital from COVID. And it's very low. There's a few, it's a low percentage, which is what we wanted to see as well. And that does mean that it seems like people are staying safe from getting infected in the SMA community, which is what we wanted to see. Another area, just to mention here, that we have seen is an actual impact on diagnosis. It's interesting to share that we've seen diagnosis of SMA by symptoms drop down during this time. And we think that's because people are staying away from going in to seeing their doctor. If they're not sure about symptoms, they don't know what's going on, they're being more cautious. And so we're actually seeing those early new diagnoses of SMA drop down over the last couple of months. And we're doing a lot of advocacy work there to raise awareness of that and try to, make sure that people are going in. That is something we put in the realm of treatment as how essential and important it is to get diagnoses done as quickly as possible. So if we want to go on to the next. So here we're laying out what we see, what our guidance is for the next steps for the SMA community. And I think we're laying this out for the next 2 months. This is what we are going to recommend, how we see the current situation playing out. And how we think the SMA community kind of needs to respond going forward, at least for these next 2 months, and then we'll reevaluate and see what the situation is. So our recommendation is to basically continue quarantine in the SMA community. Patients, families, direct caregivers need to maintain this quarantine. Our reasons for that are, while we kind of look at the overall situation, across the whole US, it does seem that, the virus is at its peak. It actually seems like it's declining. It's on kind of that downward slope on the back of the curve that you hear so much about. It does seem like that's the case. But if you step back and you actually look at the numbers of people that are currently infected who are contagious, I think as well, there's this aspect of the asymptomatic people who are contagious as well. There are more people that are out there now. There's more cases of that right now than there was even 2 months ago when we actually went into quarantine. So while things are getting better and the country can open up with new kind of, social distancing and those procedures, this virus is still out there at a very high level. And for us, that's just too much of a risk for SMA patients and caregivers to go out right now. We need to maintain the quarantine. It's just too high a risk to go out into that environment for SMA patients who are going to be at higher risk of complications and a serious impact from getting infected. So we are saying continue the current approach that we've had in place for June and July. We'll come back hopefully in the middle of July and give an update on where the situation has advanced to at that point and any changes. What we're saying is the things that we've been doing with following the standard SMA hygiene approaches that we have in flu season, the isolation protocols in a normal flu season, keep those going. As we said before, we don't think there's any particular special immunity or higher risk of actually catching the virus in SMA. The risk is SMA patients are vulnerable, especially with the pulmonary respiratory area, and that gets impacted very much by COVID. And so while there's no special immunity or higher risk of catching, if somebody gets infected by COVID, it's going to be a very serious situation in SMA, and we have to protect against that. That's why we have to follow these protocols right now. One item we wanted to touch on as well about how this could kind of change in the future and some of the things that are starting to roll out now, which could have an impact on how we respond, how we change our behaviors in the SMA community, are looking at antibody testing to see whether somebody's already got immunity. Updates on protocols. There was something recently that went around about maybe the virus doesn't spread as much as was thought between surface transmission rather than just person to person, and even potentially a vaccine that's going to come along. What we wanted to highlight is all of these areas are coming out very quickly right now. Everybody, the country, around the world are pushing these things very rapidly, and that's what we want. But at the same time, it's good to know that when that happens, some of these tests are not going to be as accurate as we would normally want them to be. The tests and protocols, information that comes out, they're not going to be as accurate as normal when we're looking at the science and the evidence behind them. And I think the real risk we wanted to point out with these is this false positive that might come up. And to explain that, maybe it's kind of looking at, say, the antibody testing. We saw a few questions come through on this. And it could be that, you go for an antibody test, looking to see if you yourself, affected, family, caregiver, already has immunity. You might get a positive result on that and then actually change your behavior and reduce the protocols, go out into the environment. What we're pointing out is there's a high risk of that being a false positive right now with antibody testing. When a vaccine comes along, there might be a high risk that the vaccine isn't totally effective. And if we as a community change too soon with our behavior, we're going to put ourselves at risk, too much risk in some ways for the SMA community. And so we want to watch that. Hopefully that makes sense. It's a little complicated, and we'll definitely come back on the vaccine side later on when that actually materializes. But again, this is another reason that while these areas are out there right now that you could use to adjust your approach, your behavior, we think they're too risky for SMA community members to base decisions on. And again, even with those out there, we would recommend staying isolated, staying inside, staying with the protocols. The surface transmission, just to highlight that one, just as, you know, this is an area where there's some new guidance that seemed to come out saying that the virus didn't get transmitted as easily over surfaces. What we wanted to point out is, you know, there's a lot of information that's going to come out like that. You've got to be careful on making quick changes in your approach based on that. It seems like actually that surface transmission recommendation was even walked back from the CDC recently. So again, be careful, go slower. As soon as some of these new protocols and procedures come out, it probably isn't the right thing to immediately change your behavior. Wait for them to get advanced a little bit more and get more accurate rather than changing your approach. How we think this is going to develop, though, after these 2 months, obviously we don't know the direction here, but we can kind of outline a couple of things that we might see and then what that might mean for us as a community. So I think one thing to watch for is if we see a second wave coming. If infection rates bounce back, the social distancing is being relaxed and it could cause another wave to come through, that is going to mean that we're going to have to stay in isolation if that's going on. So we've got to watch for that and see if that turns out. I think the same would probably apply if, you know, the rates stop going down, if it just slows and plateaus and it stays at what is kind of a high level right now of the virus being out there and people being contagious. Again, we would probably say we've got to stay isolated then. The other extreme is, you know, some of the rates are going down pretty quickly right now, some of the declines in the cases. If that continues, if we see this continued significant decline, that will allow us to then reduce these isolation and quarantine protocols. So that's what we're hoping for. We don't know though. And we're just going to kind of watch, and we'll come back again in the middle of July and say what we see as happening and whether we've got to continue on isolated or if now there's some opportunities to open up. So with the next slide. We wanted to highlight again how we're talking about various aspects of dealing with SMA and whether we're saying you should continue with those or you need to look for flexibility, or no, you shouldn't be doing them and you should be staying at home. So to reiterate, as we've talked about, treatment is essential. People should be looking to get treatment on time as much as possible right now. Maybe a little bit of flexibility of a couple of weeks to delay, but this shouldn't be cancelled and you shouldn't be putting these out for months at a time. That's been the approach, continues to be the approach. With clinical trials, a little more flexibility. That definitely it's important to keep going on clinical trials with getting the treatments, but maybe there's some flexibility in there if you're looking at the follow-up visits where it's not about getting the treatment, but it's getting, you know, some of the measurements done and some of the follow-ups. If those can be done at home, telemedicine, that's a good thing to kind of look for. All the way down to kind of the other extreme is where we're talking about care and services. You know, when we're talking about the physical therapy and things like that, that is where we'd say that you should be leaning more to not going into a medical setting, a doctor's setting for those. Those you should be continuing to look for opportunities to do at home. And that kind of lines up with the Summit of Strength webinar topics that we've been doing. So the next slide. This is the new area that we're going to start to focus on for the next couple of months. And I think we're pointing it out and some of the reasons of why we think this is going to be important and difficult over the next 2 months. And then also what we're going to look to do to try and support all of you in this area, resources, information going forward. And so I think what we're saying is, you know, these other aspects of daily living, work, school, education, social interactions, how are we in the SMA community going to deal with these over the next couple of months when it's actually going to become a more complicated situation than it has been just over the last few months? The last few months, in some ways, everybody was kind of coming into our boat in SMA and how we deal with flu season. Everybody was getting quarantined and being isolated. What's happening right now is the rest of the country is going back into these environments, going back to work, opening up. Education, not now, but in fall, we'll see if that opens up. And people are having social interactions again that are really very important. But we're going to have to stay isolated. And so that's going to be difficult. I think as well for us, we're recognizing we're obviously getting into the summer season here. The weather's nicer, but also this is dragging on for a very long time for a lot of people in the SMA community and staying isolated. A lot of people were isolated from the flu season, going back to kind of late last year all the way through. This is going to drag on. It's going to get difficult in maintaining the motivation here. And I think it's something important to kind of speak up about, talk about, make sure that we're all aware of it, and do what we can to support each other in the whole community. And we definitely, Cure SMA, will do everything we can with resources to keep that motivation going while this is going to be difficult. One area in particular I think that is going to be tough is looking at the work environment, and here saying essential work for you. We're not talking about kind of the frontline essential workers that we've been talking about here, but for a lot of you, SMA patients, family caregivers, you're going to have this situation opening up of your work environment is opening up. You're going to be asked and called to go back to work, when here we're saying as a member of the SMA community, it's not safe to do that yet. And there's going to be a balance there, a kind of a push and a pull. We're going to do everything we can with advocacy, with information. I think we'll produce more letters like we did before, and definitely take advocacy initiatives at the federal and the state level to try to say, anybody that's a member, patient of the SMA community, a direct caregiver, family member, really should be able to have the options of staying at home even while work situations are opening up. We think that's going to be very important, and we'll do all we can to back that up and try to make sure that happens. We think the social area, the interaction with extended family, friends, in-person kind of interactions, it's really too soon to do that. And we're saying that we really as a community are not yet ready to open up those doors, even to close family. Even we know how important it is, but we've got to maintain that isolation. With education, school, I think that's something we'll come back to. We're not sure yet on the whole timing of will school open up in the fall, and with education, a university is going to open up again. So we'll come back and see what's happening on the outside there of how we adapt and what our position is for the SMA community. So again, I think here the message is we're saying we know this is going to get difficult to keep this going. We're a strong community. We've definitely done very well over the last couple of months in staying very safe from this virus with doing everything that we know how to do in a normal flu season. We need to keep it going. I hope everybody's able to kind of take some strength from this community as well in responding like this, and even being able to keep all of our important research, care, treatment, regulatory work going on behind the scenes. That hasn't been impacted at all because of how strong this community is. And I think this community staying strong now for the next couple of months is going to keep us in this great position, staying safe, staying healthy, and actually even being able to keep all of our good work going still. So with that, I think the next slide, I think it's handing over to Mary to go through some of the medical items. Mary?
Hello, everyone. This is Mary Schroth, Chief Medical Officer at Cure SMA. Next slide, please. So I want to provide you with updates about where we are and new things that have come through from the CDC and other sources of information. So I'll point out to you the slide, the graphic at the bottom, that shows since the beginning of the COVID-19 and what turned into be a pandemic, the daily new cases through this month so far. And although we're seeing that the number of cases is decreasing, it's not at a level where anyone should feel comfortable. As Kenneth said, there are many, many people with COVID in the community, and we shouldn't feel safe yet. And things won't change significantly until one of two or both things happen. First, most of the people in the U.S. get infected with COVID-19 and then develop antibodies to ensure protection. And the second is the development of a reliable vaccine. And we're not close to either yet. There's two ways that we develop antibodies against an infection. Either you get the infection and develop antibodies. Your body produces a protein to help you fight against future infections. Or a vaccine is developed that uses a small part of the virus that stimulates the body to produce antibodies. So the antibody testing, as Kenneth said, there's false positives. Currently, the tests that are available not only have had false positives, but have also had some false negatives. But the second part of the problem is that determining whether these antibodies that may be in someone's body is whether they're protective or not. We may be able to measure levels, but what does that even mean? Does it ensure that someone is protected? The same way that the vaccines also have to be tested. We may be able to increase someone's antibody level, but does that mean that they're protected against actually getting the infection? So there remain a lot of questions that need to be answered, and just know that the entire world, as well as the SMA community, will need to be patient so that we can get to those answers and make the best decisions possible. And until that time, it's continue the isolation that you've been doing. Next slide. Our priorities at Cure SMA are the health, safety, and well-being of the entire SMA community, and also to provide you with accurate and timely information. So this is one of our opportunities, and also I'll direct you to the COVID Information Center at the end of my presentation. Next slide. So the symptoms that have been identified as being associated with COVID have been updated. This is from the cdc.gov webpage. Fever, cough, and shortness of breath continue to be the most common symptoms that are reported. Chills, shaking chills or rigors also can be associated with COVID. Increased fatigue, that's a significant symptom for individuals with SMA because it exacerbates or makes the muscle weakness that you're experiencing worse. And that contributes to difficulty breathing, difficulty moving, being able to get out of bed, and all the activities of daily life. It just makes whatever consequences of that infection in the body even potentially worse. So muscle or body aches has been identified as being part of COVID symptoms, headache, sore throat, congestion or runny nose, and these symptoms can occur by themselves as a presenting symptom or a suggestion of having a COVID-19 infection, or may occur in combination. In addition, there's been GI symptoms that have been identified, having an upset stomach or nausea, vomiting or diarrhea. More recently, rash has been associated with COVID-19, and you may have heard about something called COVID toes, where the toes become red and swollen. Essentially, it's inflammation of the blood vessels that provide blood to the toes, become inflamed. And also the sudden loss of smell and taste, which seems to be associated with a more mild version of COVID-19. But all of these are different symptoms of inflammation in the body secondary to the COVID. Many of them are not very specific, but if you have these symptoms, you have to assume or think about COVID-19 first before writing off those symptoms. Next slide. So I want to encourage people, just remind people that if you have the following symptoms on this list, don't wait. Seek emergency help. Call your care provider. Call 911. If you're having trouble breathing, if you have pain or pressure in your chest, if someone is confused and not making sense, that may be a symptom of having low oxygen saturation. If they have difficulty waking or staying awake, or if they appear bluish around their lips or their face, these are all symptoms that someone is having significant difficulty managing COVID-19 and should be seen immediately. Next slide, please. So the recommendations have not changed. As Kenneth said, ideally you're staying at home, you're wearing cloth masks in public. If you need to go out, physical distancing of at least 6 feet, also called social distancing, avoiding large gatherings, avoiding people who are sick, known to be sick, or suspected of being sick, wash hands often for at least 20 seconds, and clean surfaces as you always have. The confusion regarding surface transmission was a conversation about the fact that the most frequent transmission is person to person, and picking up the virus from a surface is less common, but still possible. So do not change what you're doing regarding cleaning surfaces with antibacterials. Next slide. As Kenneth mentioned, one of the things that has become apparent is that people are not seeing their physician, they're doing telehealth, which is totally appropriate. However, What's also been seen is that immunization rates significantly declined, and that is problematic. So the recommendation from the American Academy of Pediatrics, as well as from the CDC, is that if someone with SMA is under 2 years of age, it's very important for them to do their well child check and to receive their immunizations in a timely way. Receiving immunizations for everyone is really important, but especially if you're under 2. Continue to receive the SMA treatments. Most healthcare providers have been able to accommodate avoiding waiting rooms, registering in advance, limiting the number of people that you would have contact with when you go to receive a treatment. All of these things have been put in place, and contact your healthcare provider to learn about what they have available. Please know that there are no approved medications to prevent COVID-19 infection. There are also no approved medications to treat infection or complications of infection. However, if you are hospitalized, which indicates severe to critical illness, and are in a clinical trial, there are medications that are being tested, but none of them are approved. None of them have demonstrated significant improvements. If you have questions about your health, contact your healthcare provider. Or if you're developing symptoms, contact your healthcare provider, let them know, keep them in the loop about what's going on. I strongly encourage you to check the CDC website for complete guidelines. They keep that updated on a very regular basis. The information has that exponentially, and it's excellent. Also check your local or state public health department website, which gives you information about the rates of COVID-19 cases in your local area to help give you a sense of just what's happening in your community, and may help support your ability to go to the healthcare provider, get your SMA treatments, and continue to remain safe. Next slide. So I wanted to also cover some of the complications of COVID-19 infection that have received a lot of press and that people have questions about. One of the things that is being seen is that there's increased risk for blood clots, a coagulopathy for those who have been hospitalized with severe disease. So patients who are hospitalized, typically in a critical care situation, are being monitored for potential blood clots. Prophylactic treatment is not recommended. So if someone presents with COVID-19 and they're hospitalized, they're not automatically placed on anything to manage blood clots. They're treating it if it occurs because it's been inconsistent. So if you have COVID-19 and you're not needing hospital care, no treatment is recommended. One of the greatest challenges for COVID-19 is the range of symptoms, the range of how it has impacted individuals. It's been incredibly unpredictable, and the best option is to do your best to stay safe and avoid contact with other people who you don't know. Next slide, please. So we've heard that children have been less impacted by COVID-19 compared to adults. And we're learning, every day we learn more about this infection. A new syndrome has been identified, and it's called Multisystem Inflammatory Syndrome in children. And the name just describes exactly what happens. It doesn't happen very often, but more than 100 children worldwide have been reported with symptoms. This typically occurs after someone has had COVID-19 infection. Typically within 4 weeks, they will present with a high fever. They'll have high inflammatory markers in the blood, so blood tests will show a high elevated SED rate, a CRP elevated, fibrinogen, and there's multiple other markers that can be tested. They present with severe illness, and it typically involves 2 or more organ systems. So they may have a rash, they may have difficulty breathing, they may have GI symptoms. It's not consistent, but what is consistent is that it is a diffuse inflammatory response in the body, and people are very sick. It looks like Kawasaki syndrome, which is an inflammation of the arteries of the heart, or toxic shock syndrome, which looks like diffuse sepsis, and people are critically ill. We know that 3 children have died in the U.S. from COVID-19 complications. And again, we are learning more every day. Next slide. And just as a final comment, there's no known treatment other than supportive care for the MIS-C complication. Thank you for responding to the COVID-19 survey. That information has been so helpful to us, as Kenneth indicated earlier. I wanted to provide a few more details regarding that survey. We've had almost 1,500 surveys completed with parents, individuals with SMA, and other family members represented. Next slide. When we look at the survey responses by SMA type, every types 1, 2, 3 are well represented, and type 4 is represented at a rate that we expect. Next slide. So this slide shows the percent of people who reported to us that they had or were exposed to COVID-19. So this is a question that we are asked frequently. The number of people diagnosed with COVID-19 or had a positive test was approximately 0.35% of approximately 1,100 people, which means that there are 4 people within our community who responded to this survey who had COVID-19. And that is a very, very low rate. The rate, I believe, in the U.S. is 1.2% across the population. So you all have done a fabulous job isolating, quarantining, keeping yourself safe. And of those, I am aware of symptoms of one of the people. We do not have enough information to share with you the possible complications associated with having SMA and COVID-19. And again, I don't know that those 3 or 4 cases would be representative of what others would experience, because again, the disease is so unpredictable. Individual responses to that infection are so unpredictable and range from from asymptomatic, no symptoms at all, to people who are in the ICU, critically ill and may die. So I wish I had more to share with you about that, but we just don't have enough people, which is good. I'm very happy about that. But just know that. And of all the respondents, only 0.09% were hospitalized, which represents 1 person. 92% of the people who responded to this survey did not have exposure or had COVID-19. Again, I applaud you for your success. Next slide. This is a slide representing more information about COVID-19 impact on the access to care. As Kenneth indicated earlier, 37% had appointments with their healthcare provider clinic canceled or delayed. 25%, 26%, it was a personal decision to cancel or delay the appointment. And then 20% with a delayed appointment for an SMA treatment. And then the greatest difficulty was accessing services for SMA-related care. Next slide, please. So again, thank you for completing the survey. Thank you for the information that you share back with us. It helps guide us and helps us better understand the impact of COVID-19. I want to, as a final slide, point out that our COVID-19 resources, we have the Cure SMA COVID-19 Information Center, and we're updating that, and I anticipate some more updates to come soon. For any questions, please send them to info@curesma.org. Thank you. I am now turning the presentation over to Maynard Friesz, who will talk, our Vice President of Advocacy, who will speak more. Thank you.
Great. Thank you, Mary. So again, my name is Maynard Friesz. I'm Vice President of Advocacy. Happy to be with you this afternoon. or morning, depending on where you're located. I just wanted to briefly update you on the response we have received to our initial advocacy around COVID-19, and to let you know that we are currently working on in support of the SMA community. From the very start of this public health emergency, Cure SMA Advocacy has focused our efforts on education and advocacy around the needs of the SMA community. As Kenneth referenced earlier, our early focus was on ensuring access to essential care, therapies, and equipment. As we noted on our last webinar, we sent letters to states asking that they utilize the Extra CARES Act funding and flexibility to meet the needs of the SMA community, and to rescind any discriminatory policy that proposed to ration care or equipment to individuals with SMA. I can say that our collective advocacy is making a difference. Cure SMA heard back directly from several states, and we have monitored positive actions in other states. For example, on the rationing of care policies, following our Cure SMA letter and outreach by numerous other disability and disease organizations, the U.S. Department of Health and Human Services issued guidance to states noting that discrimination in healthcare on the basis of disability is illegal. Some states settled with the HHS Office of Civil Rights and changed their policies. Other states updated their policies on their own, while others issued guidance to healthcare centers in their states, reinforcing the notion that it is illegal to discriminate. On the access to care issue, several state Medicaid agencies responded to our Cure SMA outreach by outlining steps they were looking into or had already taken to expand telehealth, allow payment for family caregivers, and waive pre-authorizations of certain equipment. Keep in mind, Medicaid is a state-operated program, meaning that Medicaid looks differently in every state. So services and benefits in one state may not be available in even a neighboring state. Certainly, I want to give a big thanks out to all of you who have reached out to highlight your challenges, and to those of you who have taken on this issue on your own by doing your own outreach on advocacy or by downloading one of our letter templates to help raise the voice of the SMA community. Moving forward, our focus remains on educating policymakers about the unique needs of the SMA community related to COVID and the current reopening phase. Within days of receiving your responses to our COVID-19 impact survey that was referenced both by Kenneth and Mary, we provided Congress with real-time data on the needs of individuals and families impacted by SMA. In our letter to congressional leaders, which can be found on our webpage, we describe the ongoing need for in-home support and community services, citing, for example, that nearly 50% of SMA households reported in the survey that there were changes and limitations to accessing those very essential home and community-based services. We also highlighted the challenge SMA families have in ensuring their outside home aides and caregivers had the personal protective equipment needed to safely deliver care. And finally, we educated Congress on the dilemma many families face in going back to work to provide for their household while also trying to reduce exposure to the virus, given the high-risk nature of the SMA community. The COVID legislation that is currently being considered in Congress includes provisions that would help address the challenges raised in the COVID-19 impact survey. The current legislative draft includes dedicated funding increases for states for Medicaid home and community-based services. The legislative language outlines that the extra funding, if approved, can be used, for example, to recruit and train new home health workers and direct support professionals to address reported interruptions in service. 2, to pay for personal protective equipment for caregivers, and also related to us, to support family caregiver providers with pay and needed supplies. This was one of the questions that we received ahead of time in advance of the webinar. I should point out that the proposed dedicated funding increase would be especially important given states face new demands for Medicaid services and due to declining state budgets, a point that was made recently in a letter from the bipartisan National Governors Association. The current legislation also includes provisions to help address the concerns of workers who are also caring for a person from a high-risk population such as SMA. The proposed legislation expands what is considered a qualifying family or medical leave incident. Two of those expanded definitions directly relate to concerns identified and raised in our COVID-19 survey, including one, and I'm quoting directly from the legislation here, to care for the son or daughter of such employee if the school or place of care has been closed due to COVID-19. Or two, quote, to care for a family member with a disability, regardless of whether another individual other than the employee is available to care for such family members, or if the place of care is closed or the direct care provider is unavailable due to COVID-19. Under the proposed legislation, these eligibility expansions would only be temporary through December 31st, 2021. These provisions were included in legislation that in news reports is being referred to as COVID 4.0, or also known as the HEROES Act. The HEROES Act was approved by the U.S. House of Representatives on May 15th, so just a couple of weeks ago. However, there is not a current path forward for the legislation in the U.S. Senate, which is currently in recess this week. While congressional leaders in the White House work out their differences, the needs of the SMA community remain the same. In addition, our message to decision makers has remained consistent, which has been to advocate for the specific changes and provisions identified by SMA families as being beneficial to the entire SMA community. If you want to help advocate for these specific provisions, you can do so through our Cure SMA Online Action Center or by going directly to the address that you see right now on the slide, which is www.curesma.org/COVID-action. Our action alert simply educates Congress on the needs of the SMA community as highlighted by our COVID-19 survey. I should also point out that this alert was created before the HEROES Act was released and approved in the U.S. House, and so it stays clear of the politics of the broader COVID 4.0 package. Thanks to those of you who have already taken action on this alert and who have reached out to their members of Congress. We also hope that as a result of this webinar that some of you will also consider doing so by taking action on curesma.org/COVID-action. In closing, I want to reiterate that our efforts to educate policymakers are most impactful when we can highlight direct experiences, statistics, and or stories from the community. And so a big thank you to those of you who have helped to contribute toward that effort through your past information, whether it's direct emails, whether it's filling out a survey or jumping on the phone, because those are really helpful in the work that we do to try to help advance and to advocate for the needs of the SMA community. And certainly that will be our focus moving forward, as Kenneth mentioned. With that, I don't have anything else, and I'm going to be turning it back over to Leslie for the start of our question and answer session. Thank you.
Thanks, Maynard. We're now going to answer some of the questions that were submitted in advance of the webinar. Again, we hope some of the answers were part of the presentation, but we're going to take you through some others right now. And I'm going to start with the first question that came in and asked Dr. Schroth, would an individual with SMA but who has normal lung function be at increased risk of serious respiratory failure with COVID?
The concern with having SMA and then getting COVID-19 is that the response to the infection is unpredictable. We know that there's risk for an extreme inflammatory response in the body. With the infection, some people experience extreme fatigue as well as that intense inflammation, and that can result in difficulty breathing due to exacerbated muscle weakness in addition to extreme inflammatory response. So the answer is yes, there's still increased risk. Having SMA still is a higher risk population. If you look through the CDC .gov materials, that applies. So yes, yes. And again, the challenge is we don't know what the response to the infection will be. Thank you.
Thank you. Dr. Schroth, I know you talked a little bit about blood clotting in your presentation. Is there an increased risk for people with SMA with regards to clotting disorders that have been associated with COVID? And should the community think about taking blood thinners as a preventative measure?
The risk for blood clots in the SMA community is unknown related to COVID-19. Standard of care is that those who are not ambulatory do not take typically medications to prevent blood clots. The recommendation currently is that there should be no prophylaxis for something that may never occur. So no, please don't take blood thinners as a preventative measure with COVID-19, with the exception of being hospitalized with complications in an ICU setting where clinicians are carefully monitoring. And if they see signs of clotting, increased coagulability, then they may treat. Thank you.
Great. The next question we received is related to the vaccine or potential vaccine. Do individuals with SMA fall into the vulnerable persons group? And do we need to quarantine until there is a vaccine? Are there ways for us to move safely in society?
Maybe I could take this one. So I think we've answered this, but we wanted to reiterate that yes, SMA individuals fall into the vulnerable group, not from necessarily catching the virus, but from having serious complications. In terms of kind of, do we need to wait for a vaccine before we open up again? Not necessarily. That could be a long time out. I think more we're focused on, when the rates of infection are going to be low enough that then we can move around about in society. So it's not necessarily waiting all the way till a vaccine or not.
Great. The next question, again, sort of is an add-on to what we spoke about already. What are the statistics of people with SMA catching COVID-19? And did COVID-19 impact their respiratory system or other organs?
So in our survey of over 1,000 people with SMA, 4 people identified having been diagnosed with COVID-19, and 1 person was hospitalized. We do not know whether it impacted the respiratory system or other organs. Thank you.
Great. What are some of the guidelines for visiting family during this COVID-19 summer?
And I can maybe take this one. I know this is a tough message, but I think our message is for the next 2 months through summer, it's going to make it very difficult. But our recommendation is not to open up and have these kind of family visits coming in home at this time for the SMA community, for patients or for kind of the family caregivers.
I would add to that to encourage virtual visits, FaceTime, Zoom, Teams. We've all become very good at those. Thank you.
Great. The next question is a bit of a build on that. It says, as we're trying to figure out a new normal, what suggestions do you have for our loved ones with SMA and their families to safely go into the community sort of when needed, or is it still too early?
I think as you're hearing, we are saying it's still too early right now. This isn't going to be the normal. As Mary was just saying, I think it's still trying to find virtual ways to interact with people, whether it's the medical, the telehealth, but with friends and family, and looking for those virtual opportunities to socially interact with people. It is just too early now. We will be able to go back and we'll get back to kind of a situation more like we were used to slowly over time, but we're not there yet.
Okay, and looking at the next question again, that I'll further build. For those who must go out or need to go out for any reasons, what are some safety precautions that can be taken when needing to go into public facilities or public places when they're not at home?
I encourage everyone to take your stash of antibacterial wipes to clean every surface and allow those surfaces to air dry before touching or making contact. It's the same. It's safety precautions. You just have no idea what might be in a public facility. Thank you.
The next question this comes from somebody with a type 1 child. Should they continue to isolate as much as possible, and what guidelines might be different for those with SMA given that are being given than what are population?
So as Kenneth and I have been saying, everyone should continue isolation as you have through the viral season this winter and up to this point. Continue to isolate. The guidelines that are different are that although others are reemerging, we're not ready for the SMA community to be out risking potential exposure.
Great. And so I would imagine that the next question about recommendations for families around reopening, is it safe to interact even with neighbors or family members? If there's a need for a haircut or things like that, is that still a possibility even when taking all those precautions?
I think everyone knows the answer to this after listening to the presentation thus far, and our answer is to stay home. It's really not safe to interact outside with neighbors, family. Depending on where you live, through the various salons and personal services may or may not be available to you, but we really recommend. The risk is just too great right now. Thank you.
Looking down the line a little bit at when schools might open up, we received several questions about schools, and here's one of them. What are your thoughts about SMA kids going to school? What sort of protections would need to be in place? And maybe sort of adding on to that, Dr. Schroth, if you have siblings of an SMA patient, what kind of precautions need to take place?
Oh, excellent questions. So first of all, it's early. At this point, if you were planning to go to school next week, I would say do school virtually from home. There are a lot of opportunities to do that, and I know it's been quite variable across the country, but it's not too early to start preparing for a potential virtual school year. For siblings, it's a great question. I think our approach at this time is that they should also be doing virtual school, and we may change our recommendations in a few months depending on what happens with COVID-19 and the number of cases that are out there. So at this time, continue the isolation. Do as much virtually as you can. Thank you.
Great. And now thinking about parents who may have to go back to work, should SMA parents and family members worry about returning to work? And again, what precautions should be taken if there is no other option?
Yeah, I can maybe jump in on this one, that yes, we need to be very careful and need to be very cautious about this area. And we know this is going to be one of the very difficult ones where work is opening up. We know this can be essential to get income, and work environments are opening up. How do parents and SMA patients as well who are working stay isolated? And so I think it is looking for every opportunity that's out there to conduct that virtually, looking for that flexibility with an employer. And I think this is an area that we'll probably have at the top of our advocacy agenda, and with resources, information, letters that we can provide to you to provide to your employers, stating how high risk it is for a parent, a caregiver, somebody with SMA to go into a work environment right now.
And to add to that some, totally agree with that, but we also recognize as an organization there are parents who have had to work during this period of time, and although some of the office spaces or the work environments, I should say, are opening up and relaxing, do not change what you've been doing to keep yourself and your family safe. All the precautions you've been taking have been worthwhile, valuable. You've protected your family and continue to do those. Thank you.
Our next question comes from a telehealth service provider for elementary school children, and they ask, what do you advise on what priorities should be with our SMA students?
the first priority is to do as much virtually as possible and to not, to be flexible, to do it virtually, and to try to, there may be situations where people may be able to join the classroom virtually, depending on resources that are available. But the priority is to engage the students, but try to do it remotely and virtually as much as is possible.
Great.
Thank you.
Great. The next question is about testing. Should those with SMA and their families be tested for COVID-19, even if they're not showing symptoms?
So the recommendation right now is not to test those who do not have symptoms. Recognize that a diagnostic test for COVID-19 is one point in time. And getting routine screening is not necessarily valuable. So unless you're showing symptoms or you've been exposed to COVID-19, I recommend, and the CDC recommends, to not get testing.
Great. The next question comes from a parent. They said, I'm scared something's going to be missed since my daughter's team does not have physical evaluations with her. What should I do?
So thank you. This is difficult, and I encourage you to be in communication with your healthcare team. If the child is under 2 years of age, it's important that they receive their routine health checks and their immunizations, and that can typically be accomplished by contacting the healthcare provider's office, scheduling for a time when there's either no one else in the office or minimal people in the office, and limiting their contact with other staff.
Okay.
Thank you.
And for those that were doing, various forms of therapy, is there a good guess as to when the SMA community can resume these therapies?
Maybe I'll jump in first just to clarify, because I think we wanted to make sure that, therapies, if we're talking about the treatments, that's the area, the drug treatments that shouldn't be delayed. And so in terms of kind of resuming, those should be happening, that people shouldn't be delaying, canceling those ongoing drug treatments should be happening on as close to a regular schedule as possible. Mary, do you want to take it? This was more about the physical therapy care therapies?
Yes. If this is about this is questions regarding physical therapy, we recommend that contacting your therapist to determine whether they can provide therapy virtually. Many clinics, not only physicians, but the healthcare team members are doing telehealth. So I encourage you to explore that with your healthcare or your therapist. Thank you.
Great. And our last question is a specific treatment-related question. It says, what is the consensus regarding steroid treatment for Zolgensma during the COVID-19 pandemic?
So the steroid treatment with Zolgensma is necessary. If someone is getting Zolgensma, they start the prednisone the day before and then continue that for typically 2 months after treatment. The precautions are the same. It's avoidance, stay home, isolate, protect from exposure to COVID as much as possible. And again, the treatments are critically important to receive in a timely way. So don't delay getting a treatment for SMA due to concerns about steroid treatment. It's critically important that the treatments be given and the steroids are part of receiving Zolgensma. Thank you.
That is the end of our Q&A. So I'll pass it back to you, Kenneth.
I just wanted to say a thank you again for joining us here today. We're looking forward to the conference activities where we won't be talking so much about COVID, but back to talking about all the great progress that we've been making, not next week, but the one after. And again, though, just to say, please reach out to us if there's any support that we can give to you individually, any ideas you have for new resources, information, letters, anything like that that we can provide to help through the next 2 months. But thank you again for joining us.